Now, in my previous videos, I've covered neurological disorders that affect the people as they get older. That is Parkinson's, stroke, and dementia or Alzheimer's disease. Now, there are also neurological disorders that affect people of all ages. Now, one of them is epilepsy. Now, what is epilepsy? Epilepsy is a tendency to get recurrent seizures. Now, this is caused by abnormal electrical discharges in the brain. You are considered to be epileptic if you have had 2 or more unprovoked seizures. Now, seizures can also be provoked by alcohol withdrawal, sleep deprivation, certain medications, low blood sugar. So they can be provoked in susceptible individuals. You are not considered epileptic if you have a provoked seizure. Now, what is important for you to know are the symptoms of a seizure, as some of the manifestations of a seizure are quite wide and varied. A seizure may present as loss of awareness, loss of consciousness, jerky movements of the limbs, stiffening, loss of tone, or it may present as an abnormal sensation in the limbs, abnormal taste, abnormal smell, or abnormal vision. A focal seizure is a seizure with abnormal discharges on one side of the brain. A generalized seizure is a seizure where there are abnormal discharges on both sides of the brain occurring simultaneously. In some cases, the discharges may start on one side of the brain and then progress to involve the other side of the brain, and hence it becomes generalized. It is important to recognize certain subtle seizures. For example, some people may manifest a seizure as an impaired awareness, where they just turn pale, they have a blank stare, they do not answer, or they respond inappropriately. A general seizure is much easier to identify. It is quite dramatic in experience. Once you have seen it, you will not forget it. And you may have witnessed it yourself in movies. A generalized seizure is manifest as shaking of both sides of the body or jerking of both sides of the body, uprolling of the eyes, drooling of saliva, clenching of the teeth, stiffening of the limbs, and followed by loss of consciousness. A generalized seizure usually stops within less than 5 minutes. Now, what can cause a seizure? There are many reasons a seizure can occur or epilepsy can occur, and these reasons vary from childhood to elderly. For example, when you're young, if you've had a bird injury, this can also lead to seizures or epilepsy. If you've had infection in the brain, such as meningitis or a brain abscess, this can lead to seizures later on in life. If you have had a traumatic brain injury caused by a motor vehicle accident, this can also lead to seizures. In the elderly, if you've had a stroke or a transient ischemic attack, which is a stroke-like symptom or event, or if you've had dementia, this can also cause seizures. However, in a lot of cases, we do not know why one gets a seizure or epilepsy. It has been suggested that 6 out of 10 cases, we do not know why one gets epilepsy or seizures. Now, why is it important to know about seizures? Firstly, it can be quite frightening, both for the person having the seizure as well as for the eyewitness. When someone is having a generalized seizure, what should you do? So objects should not be put into the mouth. The only thing that is important is you keep the person having a seizure away from injury. all you need to do is turn that person to one side or the other. The entire head and body should be turned to one side, and they should be kept in the recovery position. They should not be kept on their back, because the tongue may fall backwards and obstruct the airway, and they will have difficulty breathing. They should be turned to the right or to the left, both the head and the entire body, and they should be kept that way until the seizure stops. And the seizure will stop within less than 5 minutes. Most seizures stop anyway within less than 5 minutes. Then they should be brought to hospital for further evaluation. It is important also to know epilepsy or seizures because they have wide implications on education, on employment, and there's also a burden on the caregiver. So they should be properly diagnosed and treated. I hope you've enjoyed this video. Thanks for watching, and I'll see you next time.